All right, Ninja Nerds, in this video we're going to talk about descending tracts. So what are descending tracts? Descending tracts, they basically start, for the most part, we're going to talk about in this video within the cortex. We're going to talk about corticospinal tracts. So when we talk about descending tracts, right, so we have descending tracts, we're going to talk about two different types, right? We're going to talk about corticospinal tracts, and we're going to talk about another one in separate videos, which are going to be different subcortical tracts. We'll talk about these like rubrospinal, vestibulospinal. We'll talk about the reticulospinal and the medullary reticulospinal. But we're going to focus right now on the corticospinal tracts. And there's going to be two types here. One is you're going to have what's called the lateral corticospinal tract. And the other one is we're going to talk about the anterior or ventral corticospinal tract. We're going to talk about these two. The more important one, which is going to be controlling like your distal limb musculature, is going to be the lateral corticospinal tract, and the anterior is more for the axial musculature, and we'll talk about that. Now, something else we have to understand with corticospinal tracts, where do they start? Well, let's say here, I draw a crude diagram, really quick one. I'm going to have here central nervous system, and then your spinal cord, right? From up at the top, the cerebral cortex, we're going to talk about this in more detail, but for simplicity's sake, you have a bunch of neurons here. And these neurons are called your upper motor neurons. We're going to abbreviate them for simplicity's sake as UMN, upper motor neurons. From here, they can send down fibers that move down through the cerebral cortex, through the brainstem, and synapse on cell bodies that are located within the actual spinal cord, specifically in the anterior or the ventral gray horn. From there, these axons will come out and go and innervate a special muscle. Generally, we're going to be talking about skeletal muscle, okay? And it's going to go and innervate a muscle. Now, what is this neuron right here called located within the spinal cord? We call this guy a lower motor neuron, okay? We'll abbreviate this as LMN. So we have to understand that what we're basically going to be talking about in this video is the corticospinal tracts. The upper motor neuron starts in the cortex, moves its way down to a lower motor neuron located within the spinal cord. Now, there is other cortical tracts. We're not going to discuss them in this video, but I do want you to understand that as these fibers can go down, they can give off little connections to nuclei that are located within the brainstem, different cranial nerves, like maybe the 12th cranial nerve, or the 11th, or the 3rd, or the 4th. So you might have here maybe 3rd cranial nerve, maybe 4th, maybe the 11th cranial nerve, maybe 12th cranial nerve, whatever. From here, these fibers can go out and innervate different muscles, like maybe extraocular eye muscles, maybe the trapezius, maybe the tongue muscles. It all depends. But since this is going from the cortex to these cranial nerve nuclei, we don't call these corticospinal. We actually call these ones right here, these fibers, corticonuclear fibers. Okay, and this is for cortex, cerebral cortex, descending fibers that go to the different cranial nerve nuclei that are going to go and innervate skeletal muscles. All right, but our main focus is going to be on the corticospinal tracts. So let's go ahead and get started here. Before we do that, though, we have to understand a little bit about the cerebral cortex. How does it know to send a command down? How does it do that? So if we take over here, we're going to have a section of the brain, right? So I'm taking a section of the brain where I'm doing like a sagittal section, and we're looking at one half. So over here, you're going to have temporal lobe, right? Here's your lateral sulcus or lateral fissure. And then right here, you're going to have another sulcus or fissure called the central sulcus. And then over here, you can have another one called the parietal occipital sulcus, right? So then you have occipital lobe, temporal lobe, parietal lobe, frontal lobe, right? Now, we already discussed in the ascending tracts that the parietal lobe, that postcentral gyrus, was associated with sensations. In the anterior or frontal lobe, anterior to that central sulcus, there's a special lobe here. So look at this. You have a special gyrus just anterior to that central sulcus. What is that gyrus called? They call this gyrus the Precentral Gyrus. This precentral gyrus has a bunch of different cell bodies which are going to be important in being able to send down those descending tracts. So it's the primary area of where the motor fibers begin, those upper motor neurons. So we actually call the precentral gyrus, functionally, we call it the primary motor cortex. Okay? We call it the primary motor cortex. So precentral gyrus is the structural gyrus. The functional aspect of that gyrus is that it's called the primary motor cortex. Most of the actual axons coming from this cortex controls voluntary or conscious awareness of the movement of our skeletal muscles. Okay? But that's not the only area. There's two other really important areas. And there's another one that's really shocking that usually confuses people. There's one right here. There's a little bit anterior to this precentral gyrus. There's another part here, just anterior to it. And this one is actually called the premotor cortex. So this one right here is called the premotor cortex. This one is more associated with learned and repetitive or planned motor movements. Okay? So it's associated with learned or repetitive or planned motor movements. And this one also has descending axons that can come down. There's another one just a little bit superior to that. So just a little bit superior to that one. And this one right here is called the supplementary. It's called the supplemental motor area. Okay? The supplemental motor area is also associated with certain types of motor movements. So far we have three different areas. We have the actual primary motor cortex on the precentral gyrus, the supplemental motor area, and the premotor cortex. All of these guys are going to help us to be able to initiate the movements. There's one shocking one though. This one usually confuses people. There's another one, and you guys have already learned this if you guys have watched the ascending tracts videos. You know, there's another area here. This is behind the central sulcus, this pink area. You know, behind the central sulcus, that was called the postcentral gyrus. Well, the postcentral gyrus is where we had what's called the primary somatosensory cortex. You know the primary somatosensory cortex? A good chunk, sometimes 30 to 40% of the motor fibers that are coming down are going to be coming from the primary somatosensory cortex. That's unbelievable. So we have four areas that I want you guys to remember that are going to be helping to control the motor movement, these descending fibers. What are they? Primary somatosensory cortex is one. The second one is going to be the primary motor cortex and the precentral gyrus. So this is going to be the second one. The third one is going to be the supplemental motor area, which is going to be just a little bit anterior to the precentral gyrus. And the fourth and final one is going to be the premotor cortex, which is just a little bit anterior and a little inferior to the precentral gyrus. Okay, so we know the areas that are going to help to be able to allow for the fibers to come down. But how do we know when to do that? Well, let's say that a thought comes into my mind. Where does the thought usually come? Let's say that I'm thinking about performing a movement. I'm thinking about flexing the biceps, right? In order for that to happen, there's a special area in the frontal lobe, and let's say it's just right here. They call this the prefrontal cortex. So there's just a little bit in the frontal lobe. You have what's called the prefrontal cortex. And let's say that this is where the thought comes from, the thought of being able to cause flexion at the elbow joint by contracting the biceps brachii, right? I had conscious control over that. The thought arose in the prefrontal cortex. From that, what can happen? It can send signals to these different motor areas. When it sends signals to these different motor areas, what can happen? It can stimulate these guys to send down the descending fibers. But you know, there's something really important. There's a special checking mechanism, because once we have the thought that comes into our mind to move our biceps, we have to make sure that that movement, that flexion, isn't super like low in intensity or too high in intensity. Because I want to make sure that that motor movement is just perfect, it's smooth, and it's perfectly executed. So in order for me to do that, there's special structures located deep within the cerebrum. You know, they call them basal nuclei. So you have a bunch of different structures here. We're just going to draw them right here, assume that they're right here. These are called your basal nuclei. And your basal nuclei, like the putamen and the globus pallidus and the caudate nucleus, all those structures, the thalamus, subthalamus, substantia nigra, which are associated with these basal nuclei, they're going to get information. So the primary motor area, the supplementary motor area, the premotor area, and even the primary somatosensory cortex are going to come and tell the basal nuclei of what the motor movement that they want to perform is. The basal nuclei sifts through that information of the planned motor movement, and guess what it does? It sends up its little modified blueprint of the movement. So it says, hey, there's a couple things that I think you should fix, cerebral cortex, before you send this information down. So what do we have so far? Thought, getting ready to execute the movement. Before we do that, we send it to the basal nuclei. The basal nuclei kind of modify that, prevent overshooting or undershooting of the motor movements, send it back up to the cerebral cortex. But then there's one more checking mechanism. You know, just below the cerebrum, you have another structure here. And this is called your cerebellum, right? We'll talk about these things a little bit more, but just to get the basic points here, your cerebellum also has to communicate with the cerebral cortex. So from the cerebral cortex, from these motor fibers, they have to send information to the cerebral cortex. Let the cerebral cortex know, hey, this is the planned motor movement that we want to do. You know what's so cool about the cerebral cortex, though? It's just unbelievable. You know there's a part here, right? We have the brainstem, midbrain, pons, medulla, spinal cord, right? I was going to draw a double cerebellum here. But we have this whole part here, the spinal cord, right? What's really interesting about this is that the cerebellum not only gets a planned program of what movement that the cerebral cortex wants to do, it also is getting proprioceptive information. If you guys haven't already, go watch the actual spinocerebellar tracts, because it's also getting information from our proprioceptors. So let's pretend here's our muscle. It could be from the muscles. You could have those different muscle spindles. Remember, we had the nuclear bag fibers and nuclear chain fibers that respond to stretching of the muscle. And you had the Golgi tendon organs, and they were responding to the stretch of the tendon. And all these guys were sending information in, right? Into the spinal cord and then up into the cerebellum, letting the cerebellum know of the position of our muscles, our tendons, our joints, our ligaments, all that stuff. So the cerebellum says, okay, this is the planned motor movement. This is where the position of the muscles, the tendons, the joint capsules, all the ligaments are. Now, you know what I'm going to do? I'm going to send this final blueprint back up to the cerebral cortex. Let them know we now have a perfectly planned motor movement set and ready to go. So the thought originated, got sent to this motor area. They coordinated this information with the basal nuclei, and they coordinated with the cerebellum, who's also getting information from our proprioceptors. So that the final pathway that we're going to send down is completely checked. It's a perfectly executed movement. Let's go ahead and follow it. Okay. So if we start up here in the cerebral cortex, we said that right here we're taking a section. We're doing a coronal section here, right? And you can see here that we have the parietal lobes, and we got your temporal lobe, the midbrain, the pons, medulla, and cross sections of the spinal cord here. In the actual parietal lobe, we're going to say that there's a bunch of different types of nuclei here, okay? Bunch of different types of motor neurons that we're going to talk about here. And these motor neurons, their cell bodies are located in a special lamina or section of the cerebral cortex. You know the cerebral cortex is like many different layers, 6 different lamina sections, partitions, right? In the fifth lamina of the cerebral cortex, you find these special cell bodies, okay? And these guys, these cell bodies, they're actually called they're called pyramidal cells. Pyramidal cells. Now, some of them are a little bit bigger than others, pretty big, and those are called your cells of Betz. So you might have, in these pyramidal cells, you might have special ones called cells of Betz, and these are the really big ones, and they're heavily myelinated too. But for simplicity's sake, just remember that these cells that are located within the fifth lamina of the cerebral cortex are called your pyramidal cells. Some of them that are a little bit bigger than others are called the cells of Betz, and they're heavily myelinated. Now, what do these guys do? Okay, we had the thought from the prefrontal cortex. It's being organized. We had all the coordination and the modifications from the basal nuclei and the cerebellum. We're ready to send the motor movement down. Okay, from here, these guys give off their axons, these pyramidal cells. Or some of them, which are a little bit bigger than others again, are called the cells of Betz. Very, very heavily myelinated. These guys come down in like a fan, basically like a radiating crown. What do you call this? They call it the corona radiata. Now, the corona radiata then actually condenses and compacts and moves through a special white matter structure, which is called the internal capsule. So you know this right here is our internal capsule. In the actual posterior limb of the internal capsule, these fibers funnel down. They kind of move down through the internal capsule. And as they funnel down through the internal capsule, they get really, really condensed. And there's a reason why that's clinically important, because if you remember, we talked about this in the ascending tract videos. There's an artery called the lenticular striate artery. And sometimes in people who have chronic hypertension, that artery can actually get blocked, and it can affect the blood flow to this area, and it can cause a lot of different types of problems, possibly paralysis of the muscles, because this is going to go down to the muscles. Okay? So now these fibers are coming down. Same way, what are we having over here? You're having the pyramidal cells. I'm not going to draw as many as I did on the left side, but we're going to have same thing here. And then what are these guys doing? They're giving off their axons, and their axons are coming together from this corona radiata. They're condensing, and then what are they doing? They're running through the posterior limb of the internal capsule. And now, as they run through the internal capsule, they come down, and they're going to start descending. And as they start descending, they go through a part of the brainstem. What part of the brainstem are we getting ready to enter into? We're getting ready to enter into what's called the midbrain. So now we're at the midbrain, right here, okay? To understand this a little bit better of how they're coursing through, let's come over here to the right, because I want to show you guys a special structure that it actually enters through. Because all this stuff is clinically relevant, because remember, any problem in which there's a change in the normal physiology can lead to pathology. So we have to know some of these things here. So here's our midbrain, right? And here are these little stalks of white matter. They're called your cerebral peduncles. So they're called your cerebral peduncles, right? Now the cerebral peduncles has this part here where these fibers, these motor fibers, move through. They really condense and they start moving through this area. That area of the cerebral peduncles is called the crus cerebri. Okay? So those fibers that are coming from the actual cerebral cortex, they're coming down through the internal capsule, they're going to start moving through the crus cerebri. And they're going to start funneling down through these cerebral peduncles, and then they're going to enter into the pons. So that's how this is working. So I just want you to understand that where are they entering? They're entering into the actual crus cerebri of the cerebral peduncles, and then moving continuously inferiorly. Now we get to an important point here. Remember I told you that the cerebellum is constantly coordinating with the actual cerebral cortex to make sure that there's a proper planned movement. Well, you see these nuclei here that are located within the pons? These are called your pontine nuclei. Simple, right? So these are called your pontine nuclei. They're constantly getting informed from the cerebral cortex. When they're constantly informed from the cerebral cortex of what the planned motor movement is, guess what they do? They take that information. So let's say that the information is coming down from here, right, from these fibers. And these guys can take this information of what all this motor movement is, and guess what they do? They're really weird. They say, I'm going to take this to the opposite cerebellum. So they take this information and they go through the middle cerebellar peduncles and alert the contralateral cerebellum. So again, over here, it might get some stimulation from the cerebral cortex. And then guess what they do? They come over here, they come to the opposite side, contralateral side, and they go into the actual cerebellum through the middle cerebellar peduncles and alert the cerebral cortex of this movement, right? So you have to understand here that these pontine nuclei, they're constantly interacting with the cerebellum through the actual middle. What are these structures right here? These white matter fibers here that is connecting the pons to the cerebellum. They call this the middle cerebellar peduncles. And what's important is that the cerebral cortex is constantly coming down, giving information to these pontine nuclei, which send the information to the cerebellum, let the cerebellum know of what the actual planned motor movement is, so that the cerebellum can modify it. But we want this actual motor movement to come down. So what happens is it has to actually kind of like scatter. Some of these fibers kind of scatter around the pontine nuclei, but eventually they come back into a condensed form. So some of them are going to scatter across the actual pontine nuclei. But again, afterwards, they're going to start condensing. Now, these fibers, once they start condensing, we've already gone past the actual pontine nuclei where this pontocerebellum connection is at, right? Now they're going to move through this next part. What's the next part? The medulla. Now, let's come over here to the other diagram over here for a second. So I want to show you something with the medulla. In the medulla, right here, let's make a section right here, and then let's do it like this, like this. If we kind of do like this, you'll notice here that we have kind of a special structure. This is actually called a pyramid. These are your pyramids. And over here, you're going to have the olives. So here's your two pyramids, and here's the two olives. What happens is, if we follow those fibers, those corticospinal fibers right over here, right? What they do is they start moving through these actual pyramids. So they actually start moving through the pyramids. They really get condensed there. As they start moving through the pyramids, kind of towards the distal part of the pyramids, some of the fibers will cross to the opposite side and move down. So let's follow these ones. If we follow these guys, they're going to come down. They're going to enter into the pyramids. As they enter into the pyramids, they're going to start really, really condensing. And some of the fibers, about 80% of the fibers, will cross over at the distal half of the pyramids and go down. A small percentage, 15 to 20% of them, will stay uncrossed, and they'll go into the ventral part of the spinal cord. So if you look here, what's happening at the pyramids? The fibers are decussating. They're crossing at the pyramids. So what we need to know here that is happening, what's happening here at the medulla where the pyramids are. These fibers are a very, very good chunk of them. About how much, again, is important to remember? About 80%. 80% of these corticospinal fibers are actually going to cross and go to the contralateral side. So a good chunk of these guys are going to cross. The remaining part, the remaining 15 to 20%, are not going to cross, and they're going to stay ipsilateral. Okay? So about good maybe 15, 20% here is going to stay ipsilateral, and they're going to go into the ventral part of the spinal cord. Now, from here, why is this important? Okay. We said how much is actually going down through these decussated fibers? About 80%. So about 80% of these are actually crossing. How much is not crossing? About 15 to 20%. Okay? So about 15 to 20% is not crossing. And again, where is this occurring? Where is this actually occurring, this crossing? It's occurring at the pyramids. So this is called the pyramidal decussation. All right. So far, we have covered a pretty good amount. We're almost there, guys. As we come down, these fibers start entering into their respective columns of the spinal cord. Now, what happens here? From here, let's follow the lateral first. As we follow down, these fibers that cross, they went to the contralateral side. They go into the lateral white columns. So you know over here, if you get just a little bit of spinal cord anatomy, just a really quick bit on it. These are your lateral white columns, or your lateral funiculi. This is your dorsal white column, or your dorsal funiculi. And these are your anterior white columns, or your ventral funiculi. This is the posterior gray horn. This is the anterior or ventral gray horn. And then here's your central canal, and then you have the anterior white commissure there, right? So just a little bit here. Look what happens. These fibers that are coming down into the lateral white column, what do you think these fibers are called? This is called your lateral corticospinal tract. What these guys are going to do is they're going to come down into the lateral white column, and they're going to synapse on the cell bodies of the motor neurons located within the ventral or the anterior gray horn. So look at this. They're going to come over here, and they're going to synapse. When they synapse, they're going to synapse on these motor neurons. Let's actually show them right here. Here's an alpha motor neuron, and you can also have other ones, which we'll talk about very briefly, called gamma motor neurons. Now, from here, let's actually draw the gamma. Let's do the gamma in this nice purple here. So there's a gamma motor, there's a gamma motor. Okay, so this is our gamma motor neuron, and this brown one is the alpha motor neuron. Now, from here, these alpha motor neurons and gamma motor neurons are going to go where? They're going to go to the skeletal muscles. So they'll actually go out through the ventral root and then into the ramus and a part of the spinal nerve, right? And again, what could be moving with it? This is the gamma motor neuron. All right, so now these alpha motor neurons and gamma motor neurons are going to go out to the skeletal muscles. And we said for our example that I want to flex the biceps, right? I want to be able to flex the biceps or flex the actual forearm by contracting the biceps brachii, the brachialis, all those different muscles that are associated with that, right? So let's pretend here I draw a skeletal muscle, right? Now, you know skeletal muscle, we already said that it's made up of different types of fibers. We have extrafusal, so what kind of fibers would we have? So we say we have extrafusal, which are the parts that contract. So this is the contractile one. The one that actually, I shouldn't just say contractile, it's the one that shortens and lengthens the muscle. That's a better way of explaining it. It's the one that shortens and lengthens the muscle. The other ones are called your intrafusal fibers. And these are the ones that are actually the muscle spindles. These are the ones that are associated with that proprioception. So let's take this alpha motor neuron, and it's going to go to this muscle here, and it's going to innervate the extrafusal muscle fibers. So what is this muscle here? Let's just say that this is some type of flexor at the elbow. Okay, whether it be the biceps brachii, brachialis, brachioradialis, doesn't matter. We just want to flex at the elbow. So we're going to have the alpha motor neurons innervate the extrafusal muscle fibers to cause the muscle to contract and shorten. Now, what about these gamma motor neurons? You know, inside of the muscle, you have these different types of things you have here, nuclear bag fibers and nuclear chain fibers. Now, what these guys do is they pick up the different types of stretch. You know, nuclear bag fibers pick up the onset of stretch. Nuclear chain fibers pick up the progression in the stretch. So what they do is they're important for being able to help our muscles to constantly have a nice contraction. So what we want to do is these gamma motor neurons are going to come over here to these muscle spindles and constantly cause them to become very taut. And that tautness helps us to keep a nice tone of the muscles. So it's going to come over here and stimulate the actual muscle spindles and cause the muscle spindles to be nice and taut. And because these alpha and gamma motor neurons are working in tandem, we call this alpha and gamma co-activation. All right, so again, we're going to have the alpha motor neurons stimulate the extrafusals to contract the muscle, shorten, gamma motor neurons to cause the muscle spindles to become nice and tight to maintain nice, good contractions. Okay, that is for the lateral corticospinal. Now, lateral corticospinal is very specific though. So we have to say something about this one, the lateral corticospinal. The lateral corticospinal is more associated with distal limb musculature. So more of the distal limb musculature. So more of the actual arm movements, the finger movements. So it's for very fine movements, very fine and precise movements. Okay, very fine and precise movements. The other one though, that we're going to talk about next, is going to be called the actual anterior or the ventral. So the anterior corticospinal tract. This one is more associated with the axial musculature. It's more associated with the axial musculature. So it's for more of gross movements or large motor movements. Okay? So lateral corticospinal, distal limb musculature, and the anterior is more for the axial musculature. Okay. So this one we said right here was the anterior or the ventral corticospinal tract, right? So here, we'll put right here. This guy's going to keep going down though, so let's have him come down. We'll have more room here. If we come down here through the anterior white column, and then it's going to come all the way down here. And look, it comes right here. Same thing with this guy. Follow him down. He's going to come down through the anterior white column and then come to about right here. Here's where it gets tricky. It's never always that simple, right? These guys have to cross. We have to have pretty much most of the fibers from one part of the cerebral cortex, have them going to the opposite limb. So now, this tract right here, what was this tract here called, guys? This was called the anterior or ventral corticospinal tract. And we said that this was going more for the axial musculature. When they go down into the actual anterior or ventral funiculus, right, this column, that white column, guess what it does? It crosses over to the opposite side. So it crosses over here to the opposite anterior or ventral gray horn. Then if it crosses over to the opposite anterior or ventral gray horn, guess what it's going to stimulate? It's going to stimulate the alpha motor neurons, and it's going to stimulate the gamma motor neurons. And these are going to be more specifically associated with what type of movements? Axial muscular movements. So from here, these fibers are going to go out. These fibers are going to go out. And where are they going to go to? They're going to go to the axial musculature for more of the gross, large muscle movements. Okay? And same thing here. They're going to go to the, let's just draw a muscle here. They're going to go to muscles associated with what type of movement? The axial musculature. Okay? All right. So again, gamma, just to reiterate, because repetition is always good, gamma is going to go to the muscle spindles, and then alpha is going to go to the extrafusal muscle fibers. All right, engineers, so we pretty much went over, for the most part, all of the actual corticospinal tracts. I hope it made sense. I really do hope that you guys enjoyed it. If you guys learned a lot, please hit that like button, comment down in the comment section. Please subscribe. Also, guys, if you have the time, please go check out our Facebook, our Instagram, even our Patreon account. All right, engineers, as always, until next time.